high blood pressure, hypertension. It is so prevalent in the African American community. Even if you feel like you are the healthiest person out there, you still need to get your blood pressure checked. Hypertension is the silent killer. And a lot of people realize dialysis is the end stage renal disease, but they don't realize that there's, stages in between that you can prevent becoming on dialysis. So it's just not safe for people to walk around their community. It would be exercise and be access to like gyms or health centers to be able to exercise. So a lot of times we just say, eat better and exercise. And they're like, how am I supposed to do that?
Hello, listeners. Welcome to the You Belong in Here podcast. This is a podcast where we explore the intersection of nursing and racism, racial disparities that African Americans face in healthcare, as well as the inequities that African American nurses, doctors, and nurse practitioners face in the workplace. My name is Dr. Tiffany C. Brown, and I am your host. I am a doctoral level nurse practitioner with more than 23 years of practice in the nursing profession. It is my hope that through hearing the personal stories of triumph and resiliency shared through in-depth interviews from nurses, nurse practitioners, doctors, and DEI experts, you will be empowered in your workplace and know that you belong in here. Now, let's get to our show. Hello, everyone. Welcome to another episode of You Belong in Here. I am Dr. Tiffany C. Brown, your host. I'm very excited to introduce you to my guest for today's episode entitled Black Health Chronicles, Unpacking Chronic Illness in the Black Community. So my guest for today is Dr. Amanda Atkins. She is a double certified internal medicine and lifestyle medicine physician, health strategist, owner of Enlightenment Health and Wealth. She has a deep passion for ensuring that everyone has a chance at a healthy and happy life. Her most recent focus has been to help women who are overweight prevent and possibly reverse chronic illnesses such as diabetes, heart disease, and high blood pressure. Both through her medical and personal experience, she knows how our lifestyle can lead to remarkable changes in our health and our ability to fulfill God's will for our lives. So, welcome, Dr. Atkins. I'm so thrilled to have you here today to delve into this important topic about the impact of chronic illness in the Black community.
Thank you so much for having me. I greatly appreciate it. I'm looking forward to talking to you today.
All right. I'm looking forward too. But before we jump into the discussion, I kind of want you, if you don't mind, to share a little bit about your journey into medicine and what motivated you to focus on health and illnesses in the Black community.
I decided I wanted to become a physician when I was in the sixth grade. And I always give a shout out to my sixth grade teacher, Mr. Ivy, because he made our health class very interactive that day. And what happened, so this was like in the probably late 80s. So we didn't have the technology that they do today. But he just had this big old like heart on the ground. And then like blood vessels. And us as students, we walk through, the blood vessels, the way that, blood flows through the body, through the heart and all that kind of stuff. And I was fascinated from then on actually healthcare and actually how our human body works. I was like, I wonder what it would be like to be a physician? Because prior to that, I wanted to be a math teacher because I love math. I still love math. But I was like, let's see. And so my grandfather took me to talk to his cardiologist. And I learned about, what medicine was because there was no one in our family with medicine. And so I was just like, okay, I'm going to do this. And so I just started on from there and hey, it came up with here I am today. So I actually made it. But actually leaning in, looking at health and wellness and why I'm actually talking to you today. Because, before we recorded, I was telling you how I was like very shy, just like to, go in the corner somewhere. But my own health and wellness journey really had me focusing on women, especially Black women, and illnesses that run in the Black community because I was an obese teenager. After I decided I wanted to become a physician, I realized that I was not healthy myself. So we had to actually do what they call a presidential physical fitness test in a freshman, and I weighed 199 pounds as like a 13, 14-year-old girl. And I was like, there's no way I'm going to let this weight continue to go higher. I already knew in my family was cancer, heart disease, diabetes, high blood pressure, all the things that we'll talk about. And I was like, I have to do something different. So I decided to change my health, start exercising at that time. I actually became a vegetarian at the age of 16. And then probably about 6 years ago, I became plant-based vegan. So since that time, from my freshman year in high school all the way up till now, I've been really focusing on my own health and wellness. And then just from that, patients have asked me, like, what do you do? Do you do this? Why do you recommend this? Stuff like that. And so I just feel like that I wanted to become a physician because I like health and science. But I'm still a physician and doing lifestyle medicine today because of my own health and wellness journey and really just showing people that it can be done.
Yeah, that's wonderful. Thank you for sharing that, because that tells me that, your journey, in a sense, it started with your own personal health.
Yes.
And also, of course, seeing that heart and just understanding even how the blood vessels work and that natural curiosity. Thanks for sharing that story, because I'm sure that there's somebody out there that's listening that may be curious about the same thing. So, health starts with yourself first, listeners. Okay.
Yes.
So, I kind of want to segue a little bit and just kind of jump right into the meat of our discussion today. And I would just start with what we know. So many studies and research has shown the racial disparity prevalence of chronic illness among Black and white Americans is pretty well established, but with Black adults experiencing a higher mortality and functional impairment due to chronic illness, it's greater than our white counterparts. So ultimately, we know strong links can be made between chronic illnesses and low resource communities, and they have a poorer health outcome. So, why do you think chronic illness disproportionately affects the Black community, and how has your experience shaped your perspective on this issue?
I think initially I did not realize how much it actually affected the Black community because, I'm there and I just assumed everyone in the US had, these illnesses because it was so prevalent in my own family. And then afterwards, actually like listening to my other counterparts and like, oh, you guys don't have this issue, like everybody in my family has all this kind of stuff. So that was kind of eye opening because I grew up in it. It just seemed normal, right? One, that we have to realize that that's not normal. So like in our family, like everything runs our family. And then for patients to understand that just because it runs in your family doesn't mean it has to be your own diagnoses. So that's something big that I always tell patients to look at. But chronic illnesses definitely can affect the Black community because one, we are uneducated about our own health and wellness. Again, because we just figure, grandma had it, so I'm going to have it too. So actually getting into a physician on a regular basis or a nurse practitioner would actually be great to actually talk with. And so just to actually be comfortable with that. But a lot of, African Americans do not go to the doctor or to seek health care because having to work, like most time their jobs very interfere with them actually scheduling appointments. I know that was like for us growing up, like my parents, they had to work. I don't remember seeing a doctor after getting, my, immunizations when I was younger. So you have to be very careful with that you still need to go to the doctor. And then also wanting to know what your diagnoses are and understanding them. So you want to actually have a doctor that will listen to you and know that you have a voice and you can actually understand, because that education piece is huge. And I just think that that's something that we're missing in the Black community because we don't want to actually take up the time, or we just don't want to seem like we're uneducated or what it may be. But I just always emphasize to my patients, please, please, please ask questions. I don't take offense to you, asking questions to me. But because you have to know, like I hate, hate when people come in and say, I'm taking, X, Y, and Z medication. I'm like, why? I don't know. The doctor just told me to. Don't ever do that. And that's how I tell them,
Please.
don't ever do that.
Mm-hmm.
You do not take something just because someone told you to. You want to understand why you are taking a medication. And that just baffled me that people did not know why they were taking medicines. And again, because they didn't want to seem like they didn't know what it was for. They didn't want to seem uneducated when they were talking to a doctor, especially if it's, someone of, Caucasian or another ethnic group, and they just didn't feel comfortable asking those questions. But you definitely want to do that.
I couldn't agree with you more. I mean, you said a couple of things that I feel were pretty significant. One of them, speaking up for yourself and having the ability to advocate for yourself. and knowing why you're taking these medications, right? And then two, in the African American community, myself included, it wasn't until I became an adult that I said, no, my parents' illnesses and my grandparents' illnesses will not be my illnesses.
Mm-hmm.
At some point, we'll discuss how to help people advocate for themselves in that way. Because I can say it wasn't discussed with me with a doctor, like, oh, they want to know your family history, right?
Mm-hmm.
But they don't tell you what I wasn't told. I can't speak for everyone else, but I wasn't saying, oh, this is how you should prevent these things from
Right.
happening to you. And that though some of these chronic illnesses run in your family, you don't have to have them.
Mm-hmm.
Right. And so I think that's pretty important to just, know and share as well. What do you think?
Yes, that is so important. Because people, like I said, they just assume. Because even myself, I assumed that would be the case, and you just don't want to do that. And I, I always tell them, just don't say that. Like we want to know why or what's in your family history for certain reasons to see what you're prone to. But it's like there's genes that you can turn on and off. So we just want to show you how to turn those off if they're in your family.
Yeah, absolutely. So now this is the perfect time to now discuss what are some of the most prevalent chronic illnesses affecting the Black community and what trends have you been observing?
High blood pressure or hypertension. And it is so prevalent in the African American community. Even if you feel like you are the healthiest person out there, you still need to get your blood pressure checked because hypertension is the silent killer. You don't know if you have high blood pressure sometimes for some people until they actually have a event like a cardiovascular event, like a stroke or a heart attack. And we don't want that to be your first symptom, right? Because people will say, "Oh, I feel good, so I must be okay." No, no, no. We need to have your blood pressure checked and checked on a regular basis. So at least once a year, you should have your blood pressure checked with a healthcare professional. Okay. Diabetes is another big one, and affecting from diabetes and high blood pressure is kidney disease. And a lot of us, unless you get your blood test drawn, you will not know that you have kidney disease because we don't want the first diagnoses to be because you're on dialysis. And a lot of people will realize dialysis is the end stage renal disease, but they don't realize that there's, stages in between that you can prevent becoming on dialysis. Okay. And by having high blood pressure and diabetes, a lot of patients end up having chronic kidney disease like stage 3 or 4. But again, it does not have to go to end stage renal disease, but you want to be aware because there's lots of medications that you should not be taking if you have kidney issues, because that will cause you to actually accelerate your kidney disease to end up on dialysis sooner. So again, these are, if you just like write down these things to know, those would be like the top 3, I would say, for African Americans you want to be aware of and have it checked. So blood pressure checked every year, have your blood test done. That's looking at your blood sugar and also your kidney function numbers. And that's your BUN and creatinine. So some people call it BUN, but you just want to look at those numbers. And so if you've already had blood tests done, you can go back and look through it because a lot of my patients will tell me, oh, I never knew I had chronic kidney disease. And it's usually stage 3. And I'm like, oh yeah, it's usually, I even have been guilty of this. I never actually said it out loud, but I would look at the labs. And I'm like, oh yes, they have stage 3 because like you already have high blood pressure and diabetes. But you want to ask your doctor, okay, do I have any type of kidney disease? What stage am I in? Those would be questions you would want to ask just to make sure that you're not taking, like I said, any over-the-counter medications that can cause that to get worse.
So for those who may not know, because this is for all people in the audience, it's not just healthcare professionals. And one of the reasons I asked you to be a part of this show is because not everybody has a Black doctor, right? So, that's what we're here for, to share with the masses. So what is hypertension? Like, tell us a number that when you go to the doctor, okay, I should be concerned about this. I should consider, because maybe my doctor might not say something that I understand, but so that I will know and advocate for myself, what is like borderline hypertension? What is, severe hypertension? What are the stages of that? And when should I buy my own blood pressure cuff from Walgreens or CVS so I can monitor it myself?
Yes, so that's very good. So they actually recently changed the blood pressure numbers to where stage 1 hypertension. So I know a lot of people hear the 120/80. So that's like where normal blood pressure would be. But actually, optimal blood pressure would be more like 110/70. And even as you get older, your blood pressure still should stay in that like 110/70 mark, because that's where they see like you don't have complications from high blood pressure. Okay. Once you get into the 130s at the top number or above 80 at the bottom, you want to be kind of careful, because that's really stage 1 hypertension. And a lot of my patients, once they change that recommendation or that stage, they're like, oh, they just want to give me more medications. That's why they dropped the number and I'm not going to take medicines. I'm like, that's not the case. It's actually been shown to actually increase your risk of certain complications from having a blood pressure in the 130s or above 80s at the bottom. Okay, so that's stage 1. Most of the time nowadays, a lot of doctors are not pushing medication at that stage, but they're really, want you to make the lifestyle changes. Okay, so once you get to 140 at the top, then that's usually when they're like, okay, you want to start medication, or if the bottom number is above 90. So that'd be stage 2. Very high would be like 180. And you're like, oh gosh, okay, we're getting, to the danger range here. So when you're above 180 or the bottom number is above 100, I always tell people. So that's like, ooh, if your bottom number is above 120, it's like, that's like almost like stroke range. That's the bottom number, not the top number. But then actually, if you're over 200, also that's like stroke, like waiting to happen right there and then. And I won't let people out of my office until that blood pressure is down. But it could be that your blood pressure has been that high for a while, and your doctor may not be as aggressive in getting it down, because that's also dangerous to drop your blood pressure too quickly if it's been high for too long, because your brain is used to functioning, but it still needs to come down. So those would be the numbers you would want to look at, and you would want to write those numbers down. Most of the time it's the medical assistant or the nurse is checking your blood pressure. You may ask them to check it on both sides, because they don't always do that. You may ask them to check it after you've been sitting for a while, or recheck it at the end of your visit, just so you have a couple of readings. I always think it's good, as your next question, about the blood pressure cuff, to actually be able to check your blood pressure at home. So have your own cuff. But I also recommend that people go to validatebp.org. And that's a website that actually tells you different blood pressure monitors that actually have been validated. Because some that's just like over the counter, people always say, well, is this a good one or is this a good one? And I'm like, go to that website, because everything is different. All different, companies can put out a blood pressure machine, whether it's accurate or not. And then once you do have one, to actually take it into your office visit with you and have your blood pressure checked with the office. And then you check it with your home cuff to kind of see where it actually compares to each one. So, and if it's a little bit high or a little bit low than your blood pressure cuff at home, then you just note that. And then when you're checking that at home, you can just actually adjust it from there to know if it's high or low.
That's very good information, as well as resources. I know this is kind of not off topic, but I did want to mention something that, as you were talking, it made me think about it because of myself, number one. It's occurring to me, and I think maybe other people as well who are in their 40s, premenopausal women, and what changes can happen with your hormones in your blood pressure, especially if it's a part of your family history. So, can you speak on that a little bit about how hormonal shifts can affect your blood pressure?
I can say that, yes, women have different changes that occur as they go through that change. And it's so much that we don't know. But yeah, definitely hormonal changes can cause increase in blood pressure. It can cause trouble with sleep. It can cause mental issues. Mental issues like mood swings. I don't want people to, take that out of context, or trouble with your sleep. And then also trouble with weight loss, because, your body is used to having so much estrogen in at a time, and then it changes as you actually go through that menopausal state. And so you just want to be aware that that's happening, and not to necessarily say, oh, I have to be on hormone therapy, but that's going on. And you may ask your doctor, okay, could this be due to, my female hormones changing? Is it perimenopause? What else can I be doing to actually help that? And there's a lot of, natural things that you can do that's not necessarily that you have to go on hormone replacement therapy. And I always look at, what people are eating, exercising, water intake, because all that can definitely help. Even though it's going to happen, it doesn't necessarily always feel good. And you don't necessarily have to, like I said, go on medications just because that's happening. You can do other things to change that.
Absolutely.
Yeah.
I kind of want to discuss social determinants of health, which are, for people who may not know, the non medical factors that influence healthcare outcomes. So they are conditions in which people are born, grow, work, live, and age. So, how do social determinants such as socioeconomic status, access to care, and education impact the prevalence of and management of chronic illnesses in the community, in the African American community?
It makes it so hard, I can say, because we don't have the resources outside of like the doctor's office. Especially in like where I have worked, like you ask these people and they're like, well, I don't even have access to food. Like if I go somewhere, it's like canned foods, or just the gas station down the street. Otherwise, I have to wait for someone to come get me, to take me to the grocery store, or like I said earlier, just having to work and not be able to get off and actually come to the doctor to follow up, because we want you to follow up, your blood pressure and your diabetes if they're out of control. And you're like, I cannot come another day. I cannot get off another day of work. Like they are docking my pay. I need to be paying my rent. We're in California, this is high. Like I can't be missing that. And you try to be sensitive to that, but I also like to tell people, like, I understand, and I have not always been a doctor. I have not always been in this position, but realize that you have one body, and I want to do what I can to help you. So you can let me know, when you can come in. Can we do, like virtual things? Can we do like portal messages? Something like that to keep you on track. So I always try to, even know that there's barriers that are in place, try to figure out ways that we can get around those that still help the patient in every aspect of life. I wish there were more avenues around getting healthy food to patients. And that's actually one of my projects this year, working with our church, working with another doc, that we're trying to, do a food market that really is, not just giving people food, but actually healthy food, using food as medicine. And just hoping to get that going and get those foods to people, because I think that will definitely change the health outcomes for a lot of blacks in the community, and it's just going to be a game changer. And that's very near and dear to my heart, because I'm like, every time I like say, we got to eat healthier foods, and they look at me like, yeah, if I could afford it. And I was like, I know, so what can we do? So just to know that you have, healthcare professionals out there that definitely understand these avenues that you may be coming from. But if not, if you don't actually mention that to your doctor, you may just bring it up to them, because you never know what resources they may have, or know of someone that can help you out. So you just may mention that, like if they say, oh, you need to do this, you need to eat better, or even exercise. Say, well, doc, I don't really have access to that. Do you have any resources? Can you point me in the right direction? Because that can be someone that can steer you in the right direction. They may not have the answer, because I know I didn't for a lot of people. But we may be able to actually get resources for you. I always ask, my nurse that's there, or a social worker that can help. But if you don't actually mention it, it's very hard for us to know that that's what you're going through. Because we never want to assume that as a healthcare professional that you can't do certain things. And sometimes we just don't think to ask. So if you can bring that up, that would be great. Exercise also is a big one. Like I said, sometimes in the community, it hurts my heart to say, like where I grew up, there's so much violence nowadays. Another person I knew just got um, killed, I guess you would say, with gun violence. And so it's just not safe for people to walk around their community, which would be exercise and be access to like gyms or healthcare or health centers to be able to exercise. So a lot of times we just say, eat better and exercise. And they're like, how am I supposed to do that? So if you can let us know, we can try to come up with, other avenues for you, because again, we didn't go into the healthcare profession just to say we are, doctors and the nurse practitioners and nurses. And we actually, care for people and want to help. And if you can actually let us know, then that can help us to know and try to get the resources for you. So
I think it's important to just to backtrack. Some of the things that affect African Americans' healthcare and some of the healthcare outcomes include access, right? So you mentioned that. You talked about some food deserts, which is a big thing. Like I consider that when I have patients come to see me at Stanford, you're just looking at where they live, right? Where do they have access to grocery stores? I was trying not to say the names of these girls because
Yes,
I'm not
yes.
giving anyone any credits on this
Right,
podcast.
right.
But where the healthier foods may be, where some of the organic foods may be located in some of these grocery stores, it may not be within a mile of where people live.
Mm-hmm.
Then too, when you think about costs, it costs a lot of money to buy some healthier foods. And
Mm-hmm.
you may not have the funds to do that. So yeah, I think that's great. And you also discussed some initiatives that you're working on to help, engage more within the Black community to kind of mitigate some of these issues. So I appreciate you for sharing that. How can other individuals in the community advocate for health and navigate the healthcare system a little bit more effectively? What are your thoughts?
If you're going to a doctor's appointment, I always say bring someone with you if you can, especially if you have been to, this provider before and you just felt like you weren't being heard. Because sometimes with someone else in the room, they can actually hear for you, ask questions for you, and say, oh, last time they said that you were wanting to do this. So that can definitely help. Also, I would say write down notes as you're in the office visit. And then when you come back to the next office visit, have, a couple questions. So I always have to put a caveat on this. I'm sorry to detour, but in healthcare, as professionals and the providers, we're actually limited for time also. So we're pressured on both sides. So I try to say, come in with an agenda and, let the doc know, okay, have your top two questions. Like if I don't get anything else answered, I have to have these questions answered. And then you can have more, but just realize that you have, a certain amount of time in there. Not that they're trying to say you're not important, but like it's a squeeze from both sides. So I just like to put that out there for people to know. But if you come with the top two questions and you're like, I definitely need these answered before I leave today, it's more likely to be conversational than the doc coming in and say, I just want to do this and I'm out of here. Because that doesn't help anyone. We want like 50-50 talking. I shouldn't be the one talking the whole time. You shouldn't be the one talking the whole time because I won't be able to understand why you're here. You won't understand my expertise to actually get you better. So let's, actually have a conversation about it. So I just want people to know that that's a big thing for advocacy. Also, once you leave, you want to actually make sure, you tell someone, what you were there for, have someone there. And then if you're not able to follow up with certain appointments, so say the doctor said they wanted to refer you to, this specialist, let someone else know, follow up with that doc and say, okay, I haven't heard from them. And don't be afraid to call back and ask. Like, I know, especially for African American women, other people may see us as aggressive or angry Black women. I actually hate that. And so, but I would say that no matter what, it's still your health. And as long as you come in, respectful way, like come from curiosity, I'm just trying to figure out because this is my health, to still do it. Cause I unfortunately hear still things in the background. I'm like, what do you mean? This person they need to actually have their stuff done. They're here to advocate for themselves and they want to know. So still do that. So Black community, we're talking about that. Speak up for yourself. And still go. And then use other people to help you out, whether it's like if you're an older patient, use your grandchildren or your children to call and have them, on your list of people to talk to, and have them speak up for you because that definitely helps. But yeah, don't be afraid to, speak up, ask questions because that's what they're here for. And if you don't understand something, write it down and say, is this what I understand you're saying? Because we should be doing that. We should, like I said, we want to make sure that you understand because we don't want you to leave confused. And most of the time when we're talking, because I say this day in and day out, I just assume you understand. And unless you say, oh, wait a minute, doc, I really didn't, get that. What am I supposed to be doing? Then that usually makes, me and other, healthcare professionals slow down and say, oh, let me go back to make sure you really understand what you're doing. So don't be afraid to say, I didn't understand that. And it makes it a better relationship with your physician or provider to actually get the best healthcare for you. Again, you have one body. You want to make sure you take care of it well. And if you don't get that, find somebody else. I was like, you always have that option. Don't think you have to stick with whoever was provided for you that day.
I love it. Well, you're certainly dropping some wise nuggets. I didn't even get a chance to say, this is my words of wisdom segment because you were already popping them out. So I really appreciate that. And I know that we're coming to the conclusion of our show. So you know what, Dr. Atkins, I might have to have you on for a part two because we got to continue the discussion about how chronic illness affects our community. And I want to talk more about it. So we're going to have you on for part two. You up for that?
Okay.
Because we reached the end of our 30 minutes, folks. This concludes this episode of You Belong in Here. Thank you again, Dr. Atkins, for being such an amazing guest and sharing your journey into medicine and all these pearls, these nuggets that you drop in with our listeners today. And thank you, listeners, for tuning in. We hope this episode reminds you that your presence is necessary and that you truly belong in your workplace. As usual, if you found this episode encouraging, motivating, inspiring, and empowering, then please like it, subscribe, share it with others. You can find my podcast on Spotify and Apple Podcasts currently. Tune in, in 2 weeks for our next episode where we continue to explore topics in equity in healthcare and equity in the workplace. Until then, take care and keep pushing forward. And we will have a part two of this episode with Dr. Atkins at some point in the future. So thank you all for listening and have a great day.